Hello, my name is Dr. Casey with 𝒂𝒊𝒔𝒄 Chiropractic in some Prairie, and today I want to talk a little bit more about back issues, back pain, but more specifically disc issues. So ideally we want to have several curves in the spine. So one in the neck, one the opposite way in the mid-back, and then one again the opposite way in the low back. What that does is helps alleviate or disperses the stress on the spine. So the way that I think of it, if you look at a flatbed semi-trailer, without anything on it, it's actually got a really big peak to it or even a bridge, where that weight, when it gets put on the trailer, it actually distributes out. And that's really what we want with the spine. But as you can imagine, nowadays that we're sitting more often, this curve, instead of being like this, is really getting changed. So a lot of times what will happen, we see in the office a lot, is the head will go forward, the back will go this way to compensate for that movement. So I know you've seen this before, but if the head goes forward, the low back has to compensate, and that's why we get that rounding. And as a result of that, we put a lot more pressure on these discs. So there was a study done of over 1,500 patients. They did MRIs on them, and 60% of them had disc bulges, but it really depends on if we're putting pressure on a nerve, if that actually creates discomfort, pain, sciatica, digestive issues, those types of things. So anatomically, we look at the spine like this. So this would be a side view of your low back. So we have a disc on the top, a bone, a disc, a bone, and then the yellow structure going through the middle of the bones is your spinal cord, and then these nerves branching out are nerves. So what happens is we have all this movement because of the disc, which is great, but as we decrease that disc space over time, we actually have a better chance of impinging that nerve or putting irritation, pressure on the nerve, and you can really see the difference between the two. So we have a lot more margin for error here compared to here. So this person might have a little bit of a disc bulge from an injury, but you can see how nice and healthy the spine is. Somebody with this, where that disc gets smaller and smaller, it has to go somewhere so it actually squirts out of where it's supposed to be, outside of the bone structure. That's where we start having issues, especially if it goes backwards into the nerve, okay? If you do have any questions, please let us know. But we do have great results with disc injuries and helping people getting back to doing what they love to do. We look forward to being able to help you in the office. Again, this is Dr. Casey with 𝒂𝒊𝒔𝒄 Chiropractic in some Prairie. Thank you.